and we start. In the meanwhile, I would like to thank you for your attendance on behalf of Oxford and 40 Medical. Okay, I think we can give it a start. We have a few introductory slides today before Professor Guarino starts, and I think we can get going. As I said, we have some international guests today from across Europe too. It's an honor to be holding this webinars. We are all more or less locked at home, and this is a great way to continue our work and learn. Okay, a few words about Oxford. Oxford is a medical company that studies, manufacture, and markets technology, which is generally made in Italy and is applied to the field of regenerative medicine. Our professional lines of electromedical and dermocosmetic products offer effective and innovative aesthetic treatments obtained through modern cell regeneration technologies. Our products are certified according to the highest European medical and cosmetic standards, and our commercial strategy is developed throughout our network through professional training services developed in collaboration with well-known international scientific opinion leaders. Today we have the honor of having Enrico Guarino online. We are committed to improving the well-being of men and women, allowing them to live better and improve their appearance in total safety. In the pictures here, you have myself. I'm Marco Maltoni. I'm the CEO of the company. And we have Riccardo Pelliccia, which is my partner, which is also head of product and head of regulatory. We do have today online, I will introduce you, obviously, you probably already know him, Julian from 40 Medical UK. And today's webinar has been developed in conjunction with 40 Medical. We are going to talk about the device called ZEUS. Thank you for answering to the survey. We discovered that some of you already know ZEUS. I guess those of you that are already using ZEUS would like to improve, and those of you that do not know ZEUS are interested in knowing more about it. So I'd like to spend a few words, in fact, 3 slides about ZEUS. ZEUS is a portable yet powerful device embedded with the latest generation plasma technology. Variable power, frequency, and duty cycle allow effective and flexible treatment options. ZEUS is ideal for soft surgery with what we call a multi-targeted approach. We'll discover more about this concept throughout the workshop today. So what is ZEUS exactly? We said ZEUS is a CE-marked Class 2B medical device used in various soft surgery treatments with totally modular plasma technology. ZEUS offer effective response to the clinical need of the majority of patients and is an alternative in some cases to surgical procedure such as blepharoplasty. We already had some questions around it, and hopefully we can expand on that. Face and neck lift, revision of scars, and several other treatments in various medical fields. ZEUS is not only an alternative to the use of scalpel and lasers, but allows to avoid, in some treatments, these unpleasant stitches and inevitable painful post-operative sessions. The almost total absence of pain of the so-called soft approach derives from the induced mechanism of sublimation of the superficial tissues, which allows not to transmit high quantities of heat to the adjacent uninvolved tissues, not penetrating too deeply and not affecting the nervous structures involved in the sensation of pain. This is why we call it almost painless. The plasma technology consists in the creation of a voltaic arc, which, thanks to the so-called medical electrocution or vaporization, which is made of micro burns, generally painless, as we said, helps to stimulate the instantaneous contraction of the skin, causing a visible regeneration and firming of the skin. This regenerative process takes place in a short time. It is never more than 2 to 4 weeks after treatment, but it can naturally last for several years. As we said, ZEUS is effective in soft treatments of excess skin on upper and lower eyelids, so-called non-surgical blepharoplasty or eye lifting, fine wrinkles, and slight skin laxity. But there are other aesthetic treatments in which ZEUS is particularly effective, specifically related to some of the following imperfections: wrinkles, crow feet, stretch marks, scars, acne and acne scars, barcode, periareolar lines, and neck laxity. So Oxot is obviously the company that markets ZEUS across the world, but 4T Medical is the company which is marketing ZEUS in the UK, and I'm very grateful for today's collaboration. As you can see in our board of physicians, as independent advisors, we have a number of doctors today. Professor Enrico Guarino is also our Chief Training Officer, and I hope you enjoy today's session. Before I introduce Enrico, I would like to introduce Julian Torchman. I'm not sure if I pronounced the surname correctly, but I surely did for the name. And Julian is online. He would like to spend a couple of words, introduce Enrico, and start the meeting. Julian, are you there?
Yes, I am. Thank you.
Hello?
Yeah, hi.
Perfect. I can hear you. Maybe a little bit low, but I can hear you.
Okay.
You would like to introduce a little bit for medical and yourself and
Sure.
Professor Guarino?
Okay, so my name is Julian Torsman. So I'm the managing director for 4T Medical. We're a company that's in the medical aesthetics, medical and cosmetics fields. So we've been around for about 10 years. And just going by the names I've seen for this webinar who are in attendance, so lots of very familiar names, which is wonderful, and lots of new names, which is equally as wonderful. So thank you very much. Hope you're all healthy and well, and thank you for joining in this webinar. So just to give you an idea, or to give you a bit of background about the link between 4T Medical and Oxot. So we are the exclusive distributor for Oxot in the UK and Ireland. We've got a number of other products as well, but that is obviously the main one we're talking about today. So in terms of what we offer with the ZEUS, so we offer training. So in the normal circumstances, we are all over the country offering one-to-one training. We've also offered some workshops with Professor Guarino, which we hope to have again in the future. A number of those when we can get going again. We obviously support the machine as well, and we do regular demos of the machine. For anybody interested, we can actually come to your facility and demo the device. In terms of the device, it's been around for a number of years in the UK. We've sold it all across the country. Might be interesting for you, before we get into more detail about the technology, etc., about some of the feedback that we get. Very briefly, we have our customers, medics, come back and say to us, once they've used it, they've purchased the device, it is used in their clinic on a daily basis. So it's not something that will just be in the corner gathering dust. It is a very, very good device that offers lots and lots of potential treatments. In terms of what the device can do, they say that it is extremely versatile due to the many adaptable parameters. And the other thing which we shouldn't forget and need to highlight is it is portable. So you can, if you have a number of different clinics you're working from, we've actually created some very, very nice bags. So the one that we have on demo, and it's very light, very portable. So it's something that you could carry to different clinics or different rooms in your clinic. So thank you very much. That's my introduction. I will now hand over to Professor Enrico Guarino, who, as I said, has done some workshops for us in the UK in the past. So I hand over now to Professor Guarino.
Thank you. Just a few words about Enrico. He graduated in medicine and surgery at the University of Rome, La Sapienza, in 1993. He obtained his specialization in thoracic surgery at the same university in 1998. He has then gone to great length to become a professor at the Faculty of Medicine and Surgery at the University of Tirana, and he has basically worked in private practice as well, and as a KOL for a number of companies. I happen to also live with him in previous professional lives, and I'm very honored to have him today with us. He currently lives in Boston, USA, so he's operating on a different time zone. And just a few rules for the meeting before I hand over to Enrico. We are participating with microphone and webcams muted. The idea is, as we may have difficulty to handle the dialogues with everyone else, we are trying to handle all the communication through the chat or the question and answer platforms, as you already have started doing. For this, I thank you. This workshop will not last longer than 90 minutes. So for you in the UK, it would be a 4 o'clock start, and we aim to finish at 5:30 p.m. I know Enrico is already online, so he is now unmuted. I will stop sharing my screen to allow him to start sharing his, and hopefully switching on his camera. Thank you all.
Okay.
Enrico.
Good evening for you. You hear me, Marco?
Fantastic. Yes.
Oh, perfect. Okay. Okay. Good afternoon for you. Good morning for me. And Boston is 5 hours for you. So it's very pleasant. Sorry, it's the phone. Okay. So it's very pleasant for me talking about the use of the ZEUS and the effect of the ZEUS. I make the first presentation in past with Julian in England, so with a very nice experience. The coronavirus stopped all the movement for everyone, so we need to wait for one live session. So, what is the idea of the ZEUS? Is a short presentation, video presentation for what is important for our daily activity in our office. The idea born with an electrosurgical coagulator, but with some very important difference. After we're talking about this difference, we expect a normal coagulator, and with the advantage of some regulation. So with this smooth, soft regulation, you can have a lot of tools for our daily job. So for talking about the ZEUS, we need to start talking about the electrosurgery. So since the early 20th century, electricity has been started using in treatment and in surgery. The dermoelectrosurgery is consistent in a technique with the heat generated by the passage of high frequency current enable live tissue for incised and for coagulating. So in 1926, WEEDS proceeded to produce the first generator capable to providing a cutting effect and call this device endothermic device. Only in 1928, starting the really popularity for the surgery is connected to Bovi in the United States. The best company of electrocalculator have the name Bovi connected to this surgeon. And is the field that described the using of the cutting and coagulation function. We combine during the coagulation and the cutting during a normal surgery. This is the other important point when the problem is the conduction of electricity. So we create an arch and we need to close this arch in positive and negative. Only in the 1958, Melis developed a bipolar diathermic cautery machine. So we have a close of the arch of the electricity with in the same device. We have a close, the positive and negative with this bipolar diathermic cautery. So what is important? The electrosurgery is an empirical technique, so it's not at undergraduate level, and it is important a training for the use, and not all the people have this training as good advantage of this technique with the side effect.
Enrico, we have had a couple of requests for you to activate your camera. I think someone really wants to see you.
Okay. I'm not so good at the moment. No problem.
No worry if you can. If you can't.
Okay. I put the background. Okay. So. Okay. So better. Okay. So, what is important in the idea of we starting all the study about the use of the ZEUS and the plasma effect is the coagulation and the cutting together. It's a same power. We have a greater damaging effect and create this the fulguration, the lightening, and is the idea of Pozzi in 1907. So it's a very long time study of this one. So when we have a fulguration, we produce a superficial carbonization that is inducted by a high frequency with a single terminal current and high voltage and low current. So if you use a normal electrosurgery, we have all experience of electrosurgery, we need to use a negative plate under the patient for close the circuit of the movement of the energy. In this case, with this kind of procedure, we don't touch the patients. We have created only a small carbonization superficially with an electrical arch. With this arch, we use the ionized area between the electrodes and the surface of the tissue. So we need here, this is the tip, you create this effect of carbonization. So the skin, our tip of our electrosurgery don't touch the skin. So we have different kinds of approach. So we have the cutting vaporization, the fulguration is more aggressive area, and desiccation, the coagulation, that is the idea of the plasma flow. So what is the idea of the plasma flow? We have a dermal sublimation with this voltaic arch, and you create a local carbonization of the skin with a very limited the image of the surround tissue. What is the problem when you're working with the normal electrosurgery? I've used electrosurgery in cutting effect. I cutting the skin, but the heat of the tip go around to the area of the treatment, and we burning all the tissue. So it's not possible after this kind of cutting close this area because it is so so diffusing the damage of around the tissue. So what is the plasma? So we need to give a definition of the plasma. The plasma is not all the device. It's one part of the matter. It's the fourth state of the matter. It's a gas-like state composed of ionized atoms. The ionization occurs when a sufficient energy is applied to the gas so that the electron can escape from their atoms, leaving the atoms positively charged. So when the electron is recaptured by a positive charged atom, the energy is emitted or stored by vibration or rotation of the gas molecule. So we create, this is the idea, with the tip I stay near to the skin, and this activation of the plasma of this state of the matter, I create an arch. This tightening effect in the epidermis, so we stay very superficially, and the damage is very controlled without diffusion of the heat around to the tip. So when we converting electrical energy in electrical energy, we transmitted the probe by impulse about at 1 millimeter of the skin. So we create oxygen and nitrogen and mix it around and create this plasma effect. This is created immediately contraction of the skin tissue and dermal disruption within the dermis, so very superficial. This effect created in the time stimulation of collagen fiber production for the next few months. So we have created an important activity of collagen fibers and elastin fiber and resetting of the collagen fiber. What is the problem of the aging? In the aging, we have the percentage of collagen type 3 is the younger collagen fiber go down, and at the same time the collagen type 1 reducing in numbers, the adult collagen fiber. This is the first point. The second point is that the skin have a disorganization of the collagen fiber. After a biostimulation with the plasma, we create a reorganization, a contraction of the skin with coagulation of the subdermal protein, and at the same time, a new collagen fiber. Of course, it's important, this message, for us and for our patients. It's time, the patient needs to wait time. He's not a magician. We working for regeneration effect. The first effect of example, when you're talking about the blepharoplasty, is the contraction of the skin, but the real result starting after 4-6 weeks. Why? Because we need to give time to the fibroblast to starting to produce a new collagen fiber. This is the ZEUS, and Marco presented you what is the advantage, but I repeat only for understand what is important. It's respect the other device in present in America, in around in States, in Europe of the plasma. It's more possibility to have a control. One is the frequency 25 to 7 kilohertz in 6 steps. So it's a 6-step of regulation. The signal type is a sinusoidal pulse with variable data cycle. After we're talking about this, I think it's the very most important advantage respect all the other kind of plasma device, and have 2 levels of power, 3 and 6 watt, 3 watt with the low power, 6 watt for high power. So the frequencies that in the up the big control. The second one in the bottom is the duty cycle control with different level, and the power is black is 3 watts, 3 watts, and high 6 watts. What is the concept of the duty cycle? The duty cycle is no idea of the ZEUS, but is application apply the effect of the duty cycle in the plasma effect. So the sinusoidal pulse is a variability duty cycle. It's when we have a pulse and pause. So if you have a control, different control of the pulse respect to the pause, we have different effect. When you use it, a small pulse of electricity, and a long pause, we have a coagulation effect. Otherwise, when you use it a small, a long pulse and a small pause, we have a cutting effect. So if when I say with my duty cycle level 1 have a coagulation effect, when I say 80 in maximum is 3, I have a cutting effect. That is important because we working in different kind of lesion and the treatment we can do, we need a different effect. As example, when you use it with only biostimulation effect, we working with a coagulation line. So with a duty cycle step in 1, and when you need a cutting effect, as example, when you remove some moles or some lesion on the skin, acne scar, we're working with a cutting effect. Well, this is another very important point. I can use this device for all the people, of course, but of different kind of color, yes, but it's important when we make our clinical evaluation to evaluate the phototype, the skin hydratation, the cutaneous thickness, the area to be treated, and the type of skin imperfection. Why skin hydration? Simple. More hydration is the skin, more energy go in the skin. So with the old skin, an old woman with a very thin skin and dry skin, we need low power. For a younger skin or with a more hydration, we need a high power frequency. Okay, this is the idea: low frequency, high frequency, ultra high frequency. But we working with the low high frequency.
Fantastic, Enrico. This is a very important point. We already had some questions. Can you repeat just for clarity this part? Which frequency we use according to the type of skin and the age? Yes.
Okay. So the skin, when we have a skin more dried, so all the skin is 90% the case is very dry skin. And at the same time, the skin it's very thinny in the older patient. I suggest to use a low power, low frequency. The frequency, remember, we have frequency, the duty cycle, and the power. The power is 3.6, the 3 watts, 6 watts, and the frequency is 1 to 5. More dried is the skin, more thin is the skin, low frequency I use.
Okay. We lower the frequency with the increase of dryness. Thank you.
Yeah. So, okay, we have 3 different procedures. It's my pleasure to present to you these 3 frequency, these 3 types of procedure because it's in request of patent technique in the United States with my name, and it's a combination. Why I can use this kind of procedure? Because I can combine the duty cycle, the frequency, and the kind of type I use it, and the method of use. That is important. After we, I don't talk bad about the other device, but I love this device because it's give you very safety procedure for us. The 3 technique I use it is the pinpoint matrix, the micro resurfacing, and the control vaporize. The pinpoint matrix is specific for biostimulation, the micro resurfacing for remove the superficial part of the face, and the control vaporize is for remove lesion with more aggressive procedure without damage for around to the lesion on the skin. What is the pinpoint matrix technique? It's for skin booster effect. So we use it for non-surgical blepharoplasty, for fine wrinkle treatment, for skinny tightening, and for microcoagulation of example, telangiectasia and capillary. So for talking about the blepharoplasty, because all the people, the doctor, I'm a plastic surgeon. When the first time come in my clinic, the first rep to talking about the plasma, I'm starting to laughing. Blepharoplasty, it's a surgical procedure. I remove. It's impossible to give me a solution without cutting. Of course, some dermatocalasis, very advanced dermatocalasis, is impossible to have result. But I'm starting to use the plasma, and with the use of the ZEUS, I see a really good advantage. For me, in plastic surgeon, I have a lot of patients. It's no really candidated for the surgery because it's younger or have a lot of contraindication of the surgery, and I can use the plasma effect. At the same time, I use the plasma effect in combined with the surgery for complete better my surgery. So what is of course the story of the blepharoplasty is remove skin and muscle, sometimes they require muscle, and the fat. So this gave you a lot of good surgery in a good hand, possible of side effect, and more people it's scarred or don't want or don't work. I don't like the idea of a scar. In the last 50 years, of course, a lot of periorbital region treatment with medical treatment, with the medical approach, and the use of the laser changing a little bit this kind of approach. But what is the problem? It's sure pay attention at use of the laser, because when you use the laser, it's possible to have some side effect. So it's important when you're starting for talking about the periorbital area, is important to evaluate what is the area of volume reduction or volume restoration. What is one of the big problem in the last 10 years, more or less, is the use of the filler in the periorbital area. I see a lot of side effect of the example in the lower highlight when injected a lot of filler. So we need to, before to any kind of treatment, evaluate, is important, the quality of the skin and what is the really anesthetic appearance of the patient. So it's important working sometimes all for recovery at good elasticity and at good skin thickness for have a good result. So the patient, why this is my consideration? Because the patient born with a different wide spectrum of anatomy variety, is a thin skin and thick skin, prominent eyes, deep eyes, high brow, low brow, deep upper eyelid crease, crepey skin, and to the lower eyelid. So it's different. All people have one genetical organization of the skin. So with the advancing of the age, there are something marked change that occur in the skin, in the fat, in the muscle, and don't forget, this is the first important point, the bone of the periorbital region. So when we have this changing, we have this increase of contour irregularity of the eyelid region. So we have more hill and valley. So when you analyze good this effect, this alternance of the hollow, hills and the valley, we choose the best treatment. So don't forget, it's no solution filler in the eyes. Might have a lot of the technique with a very good results. So when you're talking about the periorbital skin, we have a thin skin and thick skin, and a skin with poor elasticity. What is the result of this? We have the patient with a thin eyelid skin often have a fine, crepey skin and dark circle. This circle, these patients are due to the color of the orbicular muscle transmitted through the overlying transparent tan skin. This darkness area is most apparent in the medial portion of the upper on the lower eyelid, so it's more evident. In this case, it's no sense use the filler. And otherwise, the patients with a thicker sebaceous skin, less surface wrinkle and dark circle, this patient will have a susceptible to sleep creases, sleep wrinkle. The sleep wrinkle often perpendicular to the standard crossfit wrinkles and caused by the pillow pressing of the eyelid, cheek, and the forehead skin. So we have vertical wrinkle. In this case, is not, you have no advantage. It is a static and not dynamic wrinkle, and the Botox don't, then the botulinum toxin don't help us for this treatment. When we have a poor elasticity is another option of quality of the skin of our patients. So it's important to evaluate it's really or not really is a true excess of allied skin. So because if we make evaluation of the treatment with the maximal stretch by having the patient look upward and open the mouth widely. So we see when the skin, in this manner, the skin is still redundant skin, its patient may be candidate for the skin excision. Is not present this excess of skin, we have a risk of retraction after the surgery and the lower eyelid retraction up. So it's important, this evaluation. This is an example, in my opinion, a very good patient for the treatment with the plasma treatment. About the globular and the frontal skin is a motion and squeezing, and we have our dynamic wrinkle, the 11th, the corrugated wrinkle, the prosum wrinkle, and at the same time we have the horizontal frontal line, the forehead frontal line, forehead line. But what we have in this case, of course, we have the botulinum toxin help with the temporary prevent of the presence of the wrinkle, but don't disappear completely. Sometimes don't disappear completely because it's so the wrinkle is so deeper, it's not simple to resolve. In this case, with the combined treatment with the plasma treatment and with the Botox, is possible to have a good recovery of the elasticity and tone of the skin. That is another important point. The color of the skin is also assisted because the patient with extremely fair skin or dark skin are at risk for pigmentary disturbance with any type of skin resurfacing procedure. With the use of the ZEUS, we can use the ZEUS for all kind of patients. Is important. Why? Because we have different frequency, different power, duty cycle, and so we can use it a different approach. My suggestion is, after you see the treatment, no one session technique, but different session for the same result. So you reduce your side effect risk and hyperpigmentation, the patient have a better result. This, as example, is the treatment for the periorbital rejuvenation. If I use a combine of technique, it's pinpoint and micro resurfacing. The pinpoint and the micro resurfacing, of course, with low power. So low power, remember, is the black hole, is the 3 watts, and the frequency 2, 3. Why 2, 3, 1, 2? Of course, it's the quality of the skin. Another important point, after we're talking about the anesthesia, if I working with local anesthesia only with the Nambi cream, have no problem. I can working with the low frequency. If I use local infiltration local anesthesia with Lido, have a weight area, I need to work with a little high frequency for go deeper in the effect. Duty cycle, of course, 1. Why? Because we're working with a coagulation effect. Remember, duty cycle 1, it's small pulse, long pulse. And the tip, that is another lovely advantage of the ZEUS to respect the other device. I can use different kind of type, and I use surgical type. So it's a very safety procedure. I can use the blunt dermal tip for the pinpoint technique, and the loop for the microsurfacing dermabrasion. So we started to talking about the blepharoplasty is the goal, all the big marketing of this kind of all these kind of devices. The use of with a no invasive procedure for the upper eyelid.
Exactly,
Of course,
Enrico, and just to anticipate, we had a few questions ahead of the meeting, and they were all around the most effective techniques for performing the blepharoplasty. So I can confirm there is a lot of expectation on this part.
I know. Okay. So about the blepharoplasty is one of the most common, is the first kind of surgery procedure in worldwide, performed worldwide, have aesthetical indication, improving the appearance of the upper and the lower eyelid, enhancing the expression of the eyes, and the rejuvenation is a really younger effect, yacht effect of the face. So it's important, but at the same time, it's very a lot of range of complication, asymmetry of the eyelids, lack of tongue, lacrimal gland injury, postoperative hemorrhage, blepharoptosis, and other. Of course, I'm a plastic surgeon. When the people come to me, no problem, you have no side effect. But of course, it's possible to have all these kind of side effects. The laser, we're talking before about the laser. Of course, we have in the last 15, 20 years, we have a lot of companies that propose in special CO2 laser and the new laser. It's very good, but deep rid epidermal. I have a big experience of the use of the CO2 in the lower eyelids, in combined with the blepharoplasty upper and with a peel in the lower eyelids. Now after the use of the ZEUS, I'm changing my idea. I combine the use of ZEUS because it's a very less risk of side effect. So what is the problem of the CO2? Is the thermal injury. In the thermal injuries is a high significant rise to collateral effect during the revitalization process. So it's possible erythema, edema, risk of bacterial and viral infection, and hypertrophic scar formation, and post-inflammatory pigmentary alteration. So it's important, and don't forget, the darker Fitzpatrick skin phototypes is more risk. With the uses of, in contrast to the additive laser and the radiofrequency, traditional radiofrequency, with the plasma, we have a sublimation that leaves a layer of intact and desiccated epidermis that acts as our natural biological dressing. So we have no damage in the skin, we have no hole in the skin. And at the same time, we have avoiding the damaging the deeper plane and predisposing for a faster healing with a better aesthetic results and with no long downtime. And at the same time, with the technique of the spots techniques, and the technique of the singular small point, we create a column of treatment in alternance with normal tissue. So the normal tissue gives you a stimulation more fast of the skin regeneration. Is more or less the same of multipulsed laser. With a correct approach and less aggressive technique, it's possible to treat all kinds of skin to 1 to 4 of the Fitzgerald evaluation, and of course for dermatochalasis, excess of tissue, and fine ringer of the eyelids. And in case of Fitzpatrick skin types 5 or 6, I don't give you contraindication. I have a big experience with dark people, Asian people, without any kind of hyperpigmentation. My suggestion is pay attention for the post-treatment hyperpigmentation with a low power. So I prefer low power, low frequency active, use a low frequency, no aggressive treatment, and repeat the procedure after 1.5 months. I give more time after we're talking about the program for a good blepharoplasty. But in the case of dark skin, I suggest to give more time for the recovery. What is the contraindication? It's no absolute indication, it's relative indication. The first one is, of course, the presence of tanning with weight, because the deposit of melanin under the skin with a burn reaction. Is a soft burning, but created sure more risk of hyperpigmentation. Infection, of course, we need to resolve before the infection. Diabetes, no diabetes, diabetes, aggressive diabetes, not controlled diabetes, because the not controlled diabetes, of course, we have a long downtime. Pregnancy, of course, is not directly contraindication. I suggest to pay attention with the same for that kind of treatment. And an example, use of oral isotretinoin for the previous 6 months, seen for the hyperpigmentation, and the keloid scarring tendency. For the keloid scarring tendency, I write relative, because I, as example, use my ZEUS for the treatment of the scar immediately after 2 weeks, after 2 weeks more or less of the blepharoplasty, when I have a hyper reaction of the scar. So I use it for reduce the scar. Presence of collagen muscular disorder, but this is for all kind of treatment. Other kind of autoimmune disease, and this is important, aberrative skin procedure carried out within the previous 3 months. You have a reaction, damage, presence of inflammation cells under the skin, and don't give a good result. So it's no a fault, a failure of the ZEUS, but is the previous treatment give you this problem. And of course, the malignancy, because the malignancy is not directly, but of example, in a lesion of tumor on the skin in the area, it's preferred to use this kind of treatment. What is important? It's important when you decided to use the plasma treatment of the highlights. Is important a good evaluation, because this is my suggestion. I make this kind of evaluation for all kind of my patient, for all kind of treatment, medical treatment or surgical treatment, and it's important the specific cosmetic complaints showed by variety will looking in the mirror, because the patient have a different perception of our body respect to this is really in front of the mirror. If you use the mirror with the movement on the face, the patient sometimes evaluate better what is the really problem of this patient. It's important evaluation, the analysis of the periorbital topography and the skin of aging is important, because it's not all the highlights problem. If a periorbital wrinkle, it's a heavy fat, it's important to evaluate everything. And other very important point, please take the picture before the treatment in 6 views, that is including the frontal, lateral, 3/4, and a close-up view of the eye. So the patient watch up, so you see the excess of the skin. And of course, the picture, repeat the picture in every follow-up of this patient. Okay. So when you want to evaluate really what the excess of the skin, it's possible to open with the globe in upward guards, help in the evaluation of the excess of the skin, okay, and excess orbital fat in the lower line. Is important at the point because the picture gave you the evidence of the difference of the asymmetry of left on right, because a lot of patients don't see this kind of symmetry. How many patients have the one eye more closed for eyes visual problem respect the other side? So it's important this kind of evaluation. And when the patient stay in front of the camera, the patient is relaxed, it is possible to see more simple. Okay, what is the ideal candidate for this kind of treatment? Of course, a young patient with a small excess of skin and with still a good texture and elasticity of the skin. In this case, in which the redness of the skin is associated with more or less pronounced edema, edema, is better excluded this kind of treatment. In this of course, some patients have advanced cases of dermatochalasis, excess of skin medially and laterally, with or without the fat, but is don't want have make surgery for risk of perioperative risk, or the patient is don't want undergone the surgery. It's possible to make this treatment, but it's important. I repeat every time this in my my training and my patients. It's important evaluate the patient expectative, because the patient probably have the idea that is the plasma technique is a magician. So what is the patient? What is the advantage? So we can help use the periauricular rejuvenation with traditional surgery and perform less visible scar in the lateral third of the highlights. This is my idea. When doing the blepharoplasty, I'm changing my approach. In the past, for when the excess of skin, the dermatochalasis excess, I need to cutting the skin out of the orbital area. Now I after 2 weeks when the patient come and the first follow-up, because the first follow-up come for remove the stitch, the second follow-up after 2 weeks, 20 days, I complete the procedure with the plasma in the lateral part of the eyes and in upper. So I create a lifting up of the skin without the scar. And as example, the management I told you before, hypertrophic scar, or a review of a blepharoplasty. Don't forget, the surgery, it's not for all the aesthetic, the cosmetic surgery is not for all the life. So we make a blepharoplasty. The timing of a surgical blepharoplasty is 5-7 years connected to the aging. After 5-7 years, the skin, when the skin is have a low laxity, have a thin skin, probably reproducing new evidence of dermatochalasis. In this case, possible have approach with the plasma effect. What is the lasting of a treatment? I asked to give you my idea before you asked me. What is the time, the lasting for a medical no surgical blepharoplasty? Depend, of course, of the kind of technique, the aggressivity of the technique, and the quality of skin. But I think my personal experience now, it's around 2 years and a half, have 70% of patients with a good selection don't need any kind of treatment. In other patient, I make a new treatment after 2 years, one spot treatment. That is for remember. Don't forget to evaluate on the patient expectation, because the patient it's light. No, it's good. I make, but don't know what is the really result. This is only for. I think it's the same for you. The last patients I make the treatment for this coronavirus lockdown, I come in my for the treatment of the nose with filler and thread, because I use a thread for the medical rhinoplasty. Have a big experience, and the patient come with 10 page of picture of Facebook, internet, printed for idea, but she had no nose, and no possible chance for create what she want. Really, is an Asian woman, she needs a surgery. So for the treatment, this is my suggestion. Have a good experience, make a skin marking. So you prepare the patient we mark the lower line in here with is up of the limit of the lights, and after with the other finger you pull up the brow and you marking the excess of skin. This is the same marking we're doing during a normal blepharoplasty. So we know what is the area we can remove. After we treat after we see that for a more lifting effect in the area upper, little below the brow, for more lifting up the brow. For the anesthesia, this is your have a lot of patients have a result only with a topical NAMBI. It's very simple. You put the NAMBI with occlusion, we wait 20 minutes to an hour, and after you remove and make the treatment. In my small experience now in the United States, the people don't want to feel never pain. It's very sensible pain. In this case, I suggest to use the with infiltration of with Lido 2% Lido with a cannula. I use a 25 gauge needle blend cannula. In starting the corner, I go inside and make an incision. If you want, and Marco need, I can. It's very simple, but I have a small video, and after I send to Marco if you want the video for this local anesthesia. It's very simple. The same procedure we're doing for a normal blepharoplasty. We start in the corner. We will use the bone for guide, and you stay very superficial. You release with a fun technique, the Lido 2-3 cc, no more of Lido. All Lido, of course. I don't need the AP effect that they're doing during the surgery. This is the protocol of treatment is at the pinpoint technique, of course, with the low power, with the frequency 2, maximum 3, depend of the thickness of the skin and the hydration and yes or not infiltration local anesthesia. Duty cycle 1, because I want the coagulation effect of the duty cycle, and the blunt dermal tip. Blunt dermal tip because is a medium dimension of the tip. That is important. More thinny is the tip, more power you create in the local burning. So in this case, we have a medium.
The tip, the more the power. Okay.
Yes, when the tip is thinny, is very small tip, you have more power.
Fantastic.
More effect, because we have the tandem, we have the lightning effect. More smaller is the tip, more bigger is lightning in all these small point you inject. So it's more possible you go deeper. After we see when you use it for the closer, for the treatment of the small vessel, I use a small, very small, a needle tip.
Okay. Do you use tungsten tips at all?
What?
Tungsten?
Yes.
Yeah.
Oh, this is a big advantage. I told this before. This kind of device, we use traditional surgical tip. This is a very big advantage. The first one advantage is not simple. It's very important. What is the advantage? The surgical tip, it's special leak, don't release powder in the skin. When you use I'm starting to use other kind of device before to use the ZEUS. The tip reduce of the length after the use. Why? Because the plasma effect, the lightning create reduce the tip and release powder in the skin. So in the future, we have really possibility of material under the skin reaction. It's very important. And at the same time, what is advantage? I'm a surgeon. I use my tip. I sterilize my tip. I use every time the tip sterile new one. And it's possible use with this different technique, different kind of tip. So in this case, we
have one question. Sorry, Enrico, if you could go back one slide, just so that we don't lose it. According to what you said, the tip which is shown there may even be a little bit too big for the non-surgical blepharoplastic, according to what you said, that we may want to have more power. Okay.
Yeah, this is, okay, this is, sorry. This blunt, you see the tip, it's not, the tip is not so smaller. It's a medium. The
Correct.
company gave a cell with the device 3 different tips. 4. One is the traditional tip I use never is the larger one. One is the needle tip after we see when you make you see the vessel closer. This is a medial tip, and the other one is the loop. That is for dermabrasion. After we see, and then in this one, we have other video. Okay, so why with the pinpoint matrix, we determine the stimulation of the skin with a multi-point millimeter point technique with alternation of area treated with area don't treated. This have a double advantage. The first one is no aggressive the treatment, and the no treated area give you more faster healing of the skin. We have a very, with this kind of technique, a very small few microns of sublimation. It's very small, so we don't see nothing at the end of procedure. Respect to other kind of technique where you have a burning black dots in the eyes, with this kind of treatment, zero lesion. The patient don't see nothing. It's very important after when you see the video, I explain this one. Don't use a method, usually method of the treatment. So you start immediately to laterally, down, below to up. Why? So you don't go with the tip, don't go to with the tip more treatment in the same area, because more treatment you make in the same area, more risk of you have the burning, and more longer is the downtime. So this is my idea. We started medially, you see, medially to laterally. I create this small triangle of, it's possible with the 5-point technique. I like the 3-point is 1 point, 2 point, 3 point, 1 point, 2 point, 3 point. So, and the column, I start medially to laterally to below to up, okay, to the top. This is a patient's no candidate of this kind of treatment. It's 75 years old, have a big problem of edema, fat bag up and down, the closed, there was no eyes, no closed, but it's a patient with a lot of pathology. The first one is heart failure, diabetic, hypertension, and have the use of chronic anticoagulation drug. So it's no ideally candidate of the surgery, is no big result for this treatment, but it's possible to have a small advantage. In this case, you see the whitening in this area. It's only, so you need what is possible with this device, don't see any kind of pain for the patient. I use it only the Nambi cream. This is the marking I suggest to do. You see, I pull up the skin with the finger, the other hand, and create my line of dermatochalasis. Was the area of my treatment. You see the back. These patients have a fat back medially and laterally. So sure, with the blepharoplasty, it's possible in this patient give you 10 years younger, but it's possible. I like the same, this patient, this is my mother, so it's a good so this in design. After I starting, you see the skin point, the column protocol, I make this small tip. The patient, the contraction you see, it's only connected to the electricity in the induction in the muscle. She don't feel pain. You see the small the dot, it's very small. The lightning, when you see the light, it's a fact. If you with the ZEUS, this is another suggestion I make for lifting up. I pinch the skin in the corner of the eyes, and I create the stimulation laterally of the excess of skin for create a contraction. In this case, you see, I don't working with the tip 90 degree, but 45 degree, because I create a stimulation of collagen fiber under the skin. So you create a new column of the skin for lifting up.
Enrico, I have a few questions while we see the video. Basically, we needed to create a little bit of clarity setting for how to choose the right tip. because we showed in the previous slide a slightly bigger tip. Some of your UK clients remind we presented a technique with a very fine tip. Now you're showing us a very fine
no,
tip.
I'm changing. Okay, yeah, probably yes. Okay, I'm changing the approach because with the medium tip, it's less aggressive and have more biostimulation, and the down timing it's more faster. So I use the medium tip because I have more control of the treatment. You see, in this case, these patients, in this patient, I use a special tip. It's not in the kit of the ZEUS, because this tip is a Colorado tip. It's a surgical. I use this tip for my surgical procedure with the radiofrequency coagulator, but it's a very special tip. But you see here, we have nothing. You see any kind of burning, zero. No black dot immediately after the treatment. That's why I use this procedure. When I want a deeper plane, localized, deeper treatment, I prefer to use a smaller tip. But in the protocol is right. I send you the protocol. My protocol, I use the tip medium. Is this one? You see here is the blunt thermal tip. Is little different than the picture in this picture. It's not the tip we have. It's have no curve. It's horizontally. Is a black in the back part of the tip.
Thank you very much for the clarification.
This is another treatment in patients after a blepharoplasty. Make a revision with. This is the tip we're talking about. This one. Marco, this is the first tip I use it, but I don't suggest don't use it, this one in the blepharoplasty because it's possible it's more aggressive. You see the difference respect the patient before and these patients. What is more powerful? You see the burning in the skin. It's more evident. You see, respect the patient before. And in this case, no local anesthesia. I working along to the scar, the previous treatment of the scar, and for reduction, I working for in horizontal line.
Okay, this is very clear that as you reduce the size of the tip,
exactly. Smaller, you see the burning is, and in this case, I use of course the pinpoint technique in revision with for the vertical. You see that is more deep, is more burning, have more burning, more power. I working with the same low power and low duty cycle 1 and with 2 of frequency is more burning. Why take this risk? You see the difference? The patient today after you see the picture had no evidence, but with the same procedure I make it with the other tip, the result it's more better with a very better downtime. More fast is the time, more faster is possible repeat the procedure. You see, I don't treat. Okay, you see, this is immediately after the treatment. No, this is after 1 week of the treatment. The same patients, you see, I treat the CrossFit, but I don't go inside of CrossFit because I don't want the CrossFit. I need to create a biostimulation, new collagen fiber around to the feet for render superficially. My technique now is I have a change of technique. When you make a live session, I explain you. I create a 5-point technique with a pinpoint. I create a core, a square, and 1 point inside of the fiber. You see this? This is the treatment when the burning is more deeper. Okay. This is one patient before and after. This is a patient. The treatment is, you see, this is before. This the day after. You see little burning around my very limited lesion, and this is after 3 weeks. Zero effect, but you make the picture after 3 weeks. You see the really reduction of the excess of the skin. It's important effect and a partial lifting of the brow in the lateral side. And sometimes you see the treatment of the CrossFit treatment here. This is immediately after you see the small burning around to the eyes, and this is the result after 3 weeks. No Botox. It's really pictures, no Photoshop. Is one of the rep of the ZEUS in the United States. And in the other side, you have the same. You see the excess of skin, reducing of the skin, the treatment on the lateral of the CrossFit, and at the same time, it's important, you have a starting of xanthelasma. You see the yellow. I remove in the same session the xanthelasma, 0 scar. It's amazing procedure, safety, patients. My suggestion is have a big xanthelasma. Don't promise your patient one session resolve the problem. Starting less aggressive, starting we go with the V technique, and so the color, you go in the yellow and the fat, and suggest the patient to repeat the procedure after 4 weeks. In 3 sessions, you remove completely the deeper xanthelasma without scar. I like to see this picture in this patient. This is a symmetry patient. This is a patient, my personal patient, make in my clinic the blepharoplasty 7 years ago. And she's happy, absolutely happy with the result. And the time she's starting to come back the dermatochalasis, but she have a big problem in the left side respect to the right side. Why? Because the patient have a episode of thrombosis of the frontal artery and she stay under treatment with anticoagulant therapy. And I suggest her before to make the surgery, try 1 session with the tools. This is immediately after treatment. I work in, you see the edema because I working for create local anesthesia under the eye, so I working better for no feel the pain, and they're working very bigger all the area near to the brow. You see, in this case, I work in the same with the smaller one. You have a very small burning, and this
is the downtime.
The downtime is this is 4 weeks after 0.
So after 4 weeks, you have 0. Okay.
0. This is the result. The patient this patient have edema and swelling for 4 days. You see this effect after 2 weeks. You see this completely down after 2 weeks, but I think it's an amazing result after 4 weeks. We have a reduction of the skin of more or less 1 centimeter. And the patient, I made another treatment. Unfortunately, I have not the post-op because the coronavirus don't help me to make the picture after the treatment. This is before the second session. You see the difference. The second session have a very good result. Yeah, of course, when I treat this case, I don't make only 1 area. I treat all the two areas. Okay. This is another case. You see the difference asymmetric in the right to the left eyes is most evident in the right eyes, and I make the treatment after 2 days. You see the difference here. You see, have small note. This skin it's 5, level 5. You see the difference after 2 days. They contract the retraction, the coagulation. A small on the other side. You see small dots. This is after 1 week. You see the difference, 1 week. This is time 0. After 2 days, you see small dot, but if you're working with this very dark skin, this is after 1 week, a very big reduction of the skin. And this is after 1 month.
Enrico, we have a question from Rebecca. She's basically asking, you suggest retreating the patients. So
Absolutely.
How many times would you suggest retreating, and how distant each treatment from each other?
Okay, so first point is, my idea is, we're talking about regenerative medicine. So less aggressive, better result, less side effect. My protocol is, and my patient, talking to my patient about the medical blepharoplasty, I told, don't ask me how many treatments. You pay me the treatment. It's possible 3-4 sessions. And usually my standard is 3 sessions. When, at example, this patient in this moment, you see now, have another second session and stop it. And the timing of the treatment is minimum 4 weeks. Why 4 weeks? First point, it's more time for healing the skin. More healing is the skin, heal the skin, better, less risk of side effect. And the second one, what we working for what? For new collagen fiber producing and remodeling the skin. So we need to give minimum 4 weeks, because after biostimulation, one simple example for have idea. When I use the PRP injection, I need to wait 3 weeks after the growth factor working for the fibroblast. So in the moment I give you information at my fibroblast to work in producing the collagen fiber, I need to wait minimum 3 weeks. So for me, the best is 4 weeks of wait. If you have a dark skin, a high hyperpigmentation rise, I suggest to wait 6 weeks. 2-3 sessions. I don't tell my patient the price of treatment of session. I call my patient about the number of treatment. Sorry, now what is the better treatment?
It's clear.
The
you don't charge them for each treatment, you charge them for the result.
Exactly. This is another, I think, very amazing result of the use of the ZEUS because use the combine with the combine with the duty cycle. All the duty cycle give you this effect to expect to the other respect to the other plasma device. It's you have different kind of treatment area which can treat them, but the best one, of course, is the small vein and capillary in the face, for example, or when it's in the cheek near to the nose, it's possible to close it. The story of telangiectasis is a lot of etiology, is a family history, exposure to IV light, trauma, or the infection of facial skin, surgery, example after the rhinoplasty, is possible you have some evidence when you move the skin of the vessel, long-term local treatment with corticosteroids, high level of estrogen, emotional rosacea. So it's a lot of origin. With the traditional method, we use a thermocoagulation, electrocoagulation, is possible to have some dyschromia or atrophic scars. Of course, the laser, NDL laser is amazing, but one simple question for the doctor, not for the company to sell the product. What is the cost of one NDA laser for user? First. Second, how many times when you use the NDA laser, we open we turn on the device, we need to wait 20 minutes when they go in function. It's important to wait and have need to changing the recharging the power after 2-3 years. With the ZEUS, we have zero cost. It's very simple to use it, and it's very very really immediate result. The same in this time in this kind of treatment, I use local anesthesia. I prefer don't use, of course, in infiltration anesthesia, because you create edema and weight area. It's more difficult to close to create a thermal coagulation of the vessel. So I prefer to use a local cream 20-30 minutes before the coagulation. And usually patients without anesthesia have feeling all a small rapid burning on the skin. And in this case, so you see the difference, we're talking about the difference, the pinpoint technique, the same small point with the high power. Why high? Because I want a very strong power and a strong frequency, the maximum 4 or 5, high power, but the duty cycle 1, because 1 is a coagulation effect. And the tip, I use the needle tip. You see this needle, it's very teeny tip in the tip, so I can stay near to the skin, and it's possible go deeper when I need. In we go with we use a microcoagulation, 1-2 millimeter, one apart the other one, along all the capillary. We start one way and follow the capillary for arrive at the end of the capillary. And stay perpendicular to the skin. So you stay perpendicular to the skin, you go directly in closer of the vessel. And we working, what is the advantage? We have a pedal. When you push the pedal, the device working. When you remove, we have reducing. My suggestion is for a voltaic arc emission is only when you stay so near, so close to the skin. So I push the pedal and I move my hand along to the capillary. So it's important when I push the pedal and I move only my hand piece with the hand near to the skin, I'm sure stay in the correct way. One suggestion: when you make call the company for a demo, if you use the tip and with the pedal activity of the device and the tips touch your skin, you don't feel nothing because don't close the voltaic arch. Possible you feel a small electricity conduction immediately when the skin, the tip they touch the skin, but no else. Okay, this is possible when you have a large telangiectasia to repeat the procedure 2-3 times. The best one is this kind of vessel. You see the small tipper, I follow 0.2 millimeter and close the vessel immediately. The color is not good, but in this is more better, you see.
But you never touch?
Never, no, because when I touch, I don't close the arch. It's important, the device working all in the moment we have the lightening. No lightening, no effect. It's a very simple procedure. In this case, the same, I suggest to don't repeat the procedure faster and don't create burning more, respect the distance 1-2 millimeter and told your patient, come back after 3 weeks in case you repeat the procedure.
Just one more question. One more question related to the topic. Can venous lakes on the lips be treated with ZEUS? And if yes, how would you do it?
Oh, sorry, say again.
Venous lakes on the
lips.
lips.
It's possible. The problem with the lakes is important to identify the starting. Where is the origin of the vein? I close this is the simple. It's the same. Okay. I close this angioma, but I working around and need to arrive and the origin, the vessel that give you blood and the lesion. You see, I working around, okay, and after I arrive in the origin of the point. You see the burning. In this case, I working. You see that big lightening because I working with a small tip, the needle tip, with a high power, 6 watts, high frequency, 6 of frequency, and with duty cycle 1. I vaporize all the lesion. You see the bleeding. This is the point of the origin where the bleeding arrived. Where is the vessel that give you blood of the lesion? This is the same for the in the lip, the same one.
This is an example for closing an angioma, but would you suggest obviously removing it and testing it?
Remove?
The angioma and test it instead? No,
remove. Why remove? No, I don't. I should. Okay, this is a benign lesion. Of course, it's not a big problem. I create I vaporize the lesion. I don't cutting because if you cutting, I don't find. I need to arrive to the vessel that create give the blood at the lesion.
There's no need
to
test the part. Okay.
You see this. You see the black. This is no. The vest is not the angioma. It's all the carbonized part of the vessel. I don't remove with the lesion. Okay. Now we're talking about the micro resurfacing. I think it's another very nice technique that we can use it with the ZEUS, with the combine of the duty cycle with the power and with the frequency. So it's we have different kind of treatment for we starting for the surface dermabrasion is a soft peel or laser, but with this kind of sometimes you have risk of scar. With the use of this procedure, we can work in a deeper wrinkle for help it to reduce the deepening of the wrinkle. So it's possible combine this kind of procedure with other procedure. For example, with a soft peel, have a publication with the ZEUS in combined with mandelic acid in the treatment of the smoker line, the mandelic in the lip line, with a very amazing result in the time with one single session. It's possible working with PRP. I love the PRP. The idea is, I use the PRP. I don't know in England what is the regulation for the use of PRP, but the idea is the PRP. I use the PRP topical or injected. I prefer using injected because it's so expensive procedure, it's so amazing procedure. I don't think it's good to use the PRP with topical treatment, microneedling or other kind of treatment. But it's possible with the dermabrasion use the example PRP, use the PRP injected, and the PPP, you have a part of plasma, pure put a gel up the treatment with the dermabrasion. It's possible combined with the thread. It's possible combined with the filler around the lip. So it's very simple procedure. It's very important because we don't have the touching of the skin, but we have all the lightening. And with this kind of, it's possible to use this micro resurfacing for smoker line, for the tech neck, for the rhinophyma, keratosis, lentigo. It's possible to use it. In this case, I use micro resurfacing, a low power frequency 1 to 3, and duty cycle 1, 2, or 3 when I'm working more deeper. But 2, it's perfect. Why 2? Because the 2 is similar for the surgeon. So I'm not talking at the spray coagulation. It's coagulation, but cutting at the same time. And in this case, I use a loop tip because so in the small part of the tip, I have in the loop, I have the lightening. This
just for clarification, the frequency is based on the type of skin again. Okay.
Yeah, exactly. Absolutely, yes.
Okay.
More dry. This, for example, this patient is an older patient, 70 years old patient. I working with 2 of frequency. Okay. This
I wouldn't like to say something wrong, but there's a possibility that 4T Medical is going to get involved with PRP too. So it's a great.
Yeah, without problem. This is the resurfacing. Okay, you see the lightening in the tip. I don't touch the skin. I go very superficial. Okay, you see the contraction of the lip is possible. You see, in this case, it's only connected. You see the lip move. It's connected the electricity effect on the skin. You see the movement. This is only the diffusion of the reaction, electricity reaction. I make the dermabrasion very superficially. You see the stuff up to the tip is the skin dermabrasion. It's very superficially abrasion. Okay. I put, in this case, I put a zinc cream because after this patient I use the combine with the peel, with the soft peel in mandelic acid. The company have this mandelic acid. I suggest to try because it's a very good peel.
So you associate the barcode peeling with this treatment?
Yeah, exactly. If you want, I have an international publication in dermatology research of this mycandic technique.
Thank you.
This is the patient after 12 months. You see the difference? The lip, it's not my work. I repeat every time because this is the mother of my student in the University of the Training for the medical aesthetic master, and she make a lips as terrible lips because in 72 years is no good. But you see really the advantage of the skin. You have a little hyperchromium metal, but you see the difference. I think it's it's amazing results, because this picture, the before is smaller, the picture, so you see the deeper in this area, more bigger you have, the deeper is completely disappear. This patient, I love present this patient because this patient is a 65 years old. I make three sessions of treatment. This patient is a very, very difficult patient. Why? It's a smoker patient, but the big problem is a double cancer, breast cancer, radiotherapy, hormonotherapy, and chemotherapy. So it's very difficult. This is the result after 12 months. I think it's not beautiful. More. It's a very nice result. What kind of treatment is supposed to give this result with any kind of side effect? Zero, because these patients have no laser is impossible, because hyperchromatosis, hyperchromia is more frequent in this kind of patients when you use the laser and after radiotherapy and chemotherapy. And in this patient, the filler have no possible results. This is a smoker. What time don't they have the results? Probably for 2 months. And the Botox too have a problem, because she have a very thin lips, and it's possible you make the Botox, the patient no move the lips. And don't forget, this is a smoker. She don't like stay 1 month with a possible smoker. So other kind of treatment, it's high power, 2 frequency in duty cycle and in case I working for the keratosis. Very simple. This is a procedure of 2 minutes, no anesthesia, zero. With my amazing loop, I love this loop. You create abrasion. In this case, I'm working with high power. It's a young skin. I remove. That's it. 2 minutes of procedure. 2 minutes. I pick this more retouching of the border of the skin. That's it. Scar, zero. This is immediately after. I suggest to put cream recovery, no other kind of treatment. The evaporation is the last procedure, on the right to the end, is a technique that to the plasma effect, we create evaporation and treat the area without heat diffusion. This is important. We working with the laser. I love the CO2 laser. I use the CO2 laser in my clinic for surgery, remove scar lesion, but it's important. It's not so concentrated. I need to pay attention because I'm burning the tissue around to the lesion. In this case, I had nothing diffusion, a very limited diffusion of heat in the surrounding area, and very low risk of side effect. Skin tags, mole, epidermal lesion, xanthelasma, wart, and scars. In this case, I use the medial tipple, the tip very thin, with techniques control vaporize, high power, 6 watts, frequency 3.5. Yes, why low frequency? I need very high power and duty cycle 5 and right 5. Depend of the kind of device you have. Is right. The new one is right 5. The older one is right 3. But it's 5. It's cutting duty cycle. Long pulse, small pulse, and I use the needle tip. This is an example. Very clarification of what is possible to doing with the ZEUS in our office. We no need to have the laser open. Okay, this without anesthesia. Okay, these patients have a contraction, not because she feel pain, only because she have the contraction connected to electricity diffusion. And I use, in this case, I pinch my skin with the finger and I vaporize the complete lesion. It's 3 minutes of procedure. This is immediately after the treatment. And this is after 1 month. It's completely disappeared without any kind of scar. In this case, the same. Don't go deeper. Tell your patients, I make a retouch after 1 month. Why? Because if you go deeper, you go in subdermal area, you create a scar. It's better repeat the procedure. Okay, this is one solution I use, but is for the post-treatment. Okay, so what is important, the advantage of respect to the procedure is a possible setting in combine of duty cycle and with the control of the pulse and the pause is important. The frequencies give you other different different control. Other devices have only one kind of frequency, or in some case you have 3 devices in the same machine. So it's not so more advantage. And one other important point, this is for me is important. I told you before, I said you before, I repeat now, it's I use a surgical tape. No have risk of powder, metal powder remain on the skin, so have no risk of foreign body reaction over time. And believe me, I some patients with the plasma treatment in the last years. I make the surgery, had very bad tissue under the skin, and the problem for healing the scar after the blepharoplasty. So I'm finished my presentation. I hope to stay in the time. It's no longer. I'm free, Marco. I'm ready for some other question.
So I would like first to thank you, Enrico, for the fantastic master lesson. We call it Lezione Magistrale in Italy. Today we are in Britalian mood. So we start seeing some comments coming in about the feedback, and I can already tell you, Enrico, that everybody has enjoyed the course so far. And I would like to keep a few seconds. First, to thank you all for the attendance, and secondly, to thank Julian and the 4T medical team because you know it's a great long-standing collaboration that we are willing to expand and build upon. And as I was saying earlier to Julian, it's fantastic that we can coordinate even in times of coronavirus. This online gatherings for doing some clinical updates. So I think it was very, very well appreciated today. And I would like to run a first demand for questions. If anybody has got questions, as we have most of the audience online, you can do them now either through the chat area or through the Q&A area, and we can answer them live. Otherwise, if you are already satisfied with the content and there are no more questions, I'd say we are probably done. We are slightly we were slightly longer than anticipated. We should have finished 10 minutes ago, but that's a good sign because we covered more things and we had lots of questions. I'm not sure if Julian wanted to say a few words or if he had any comments or questions, so we can and then we can move to the next phase, which in most cases is close to dinner. I don't see any question coming up. I think the audience is happy. We had few actually throughout the webinar, and it was good to be able to answer them as we went along. If there are no more questions, and if Julian doesn't want he doesn't have any remark, that's also fine. Julian, I see you are muted.
Yeah, no, thank you very, very much for the presentation. I think it was very, very useful, and I hope it was very useful to all the people that joined for the webinar. Of course, we're here to answer any questions as well after this webinar. So we support the machine, we support with any question and answers. Obviously, we've got a direct link with Oxots and you guys as well. So it's an ongoing thing, obviously, and as well, you know, if you do purchase the machine, then support is ongoing with that purchase as well. So please don't hesitate to get in touch after this. And once again, thank you very much.
Thank you, Julian, and thank you, everyone. Just a technical question. We recorded this meeting, and we will make the video available. It's a YouTube link. So some of you have requested the slides. We cannot circulate the slides for privacy reasons, but we can have a recording of the meeting. So it's probably better than having the slides because you get Professor Enrico Guarino too. And if that's all, I would like to close the meeting and thank you very much.
Thank you very much.
Bye bye.
Bye bye.
Bye, everyone.
Bye.